Well, Dr. Lodi, it's such a pleasure to have you on the show, Integrative Cancer Solution with Dr. Karlfeldt. You have been working with cancer for how many years now?
Only with cancer for about 21, 22 years now. I've been practicing for 35 years, but.
And you, out of curiosity, I mean, you started, you really didn't want to become a medical doctor. I mean, it was kind of a field that you, I wouldn't say you got pulled into it out of curiosity, or just feeling that there was a certain need that you needed to fill.
Exactly. That's it. What happened was I had spent, I guess when I was like 19, I dropped out of UCLA. I was at UCLA, and I just looked around the Western world and I said, there's really no role I want to emulate. I don't want to be a doctor, a lawyer, a businessman. None of these attracted me. And I was really interested in Eastern religion and philosophy. I had been reading a lot. And so I just sort of said, what am I doing? So I moved to India, bought a one-way ticket and lived there for a couple of years on an ashram and things like that, until I realized that, well, not for me, at least not this lifetime, right? So I came back to America, and then I looked for a way to kind of satisfy that desire in me to understand people and all that. So I went into psychology, and I did graduate work in psychology, and I practiced as a psychologist for a while. But I kept coming up to a situation where I didn't understand the pathology, and I didn't understand the medications they were taking. And finally, and there was one amazing situation where I just didn't understand that this man, he was a young man. I was called by the nurses. I was director of psychosocial services for this 240 bed care facility. And this man was like 38 years old, and he was having problems with the nurses. So I went and I evaluated him, and I talked to the nurses, and I gave my report, but I said, well, I'm gonna talk to the doctor first and just tell him what my plan is and get his approval. So I did, and he said, that's very good. I just want you to keep one thing in mind, that this guy has something called alpha-1 antitrypsin deficiency, which means that his, it's got certain manifestations. One of the things is you get emphysema early on as a child. So by the time he reached puberty, he literally couldn't do anything more than just walk from one chair to another. He just extreme emphysema, right? Now, on the other hand, he has the same hormones as you and me. He's a normal male, and here he is around these young nurses. So you might consider all of that in why he's causing problems, why he seems to be and I realized, I said, whoa, not having that side of the picture, how can I really help people? So I decided at that point to go back to medical school so I could round out my knowledge, just because I feel like I had studied spirit. I grew up as a Christian, and I studied a lot of other spiritual disciplines, and then I went into psychology, so spirit, mind, but I didn't understand the body. So that's why I went to medical school.
So how did you end up then working with cancer? I mean, of all the different things, I mean, here psychology, then medical, and now you're at integrative cancer care. I mean, how did all of that come about?
After working as a conventional doctor for about 10 years, I left to study with other people, other types of care. I went to Japan. I studied there. I looked at shiatsu, but I also talked to some of their medical doctors. I did the same thing in Mexico, Europe, and around the U.S. I studied with someone. I'd read a book, and if it made the sense, I'd go apprentice with that guy for a while. So I did this for a couple of years, and then I wound back to New York City and got a job with Robert Atkins, if you remember the Atkins diet, the famous Robert Atkins. And he was amazing what he knew. I just don't agree with his diet at all, but and neither did his body, obviously. But anyway, I learned a lot from him, and that's where I think I kind of got there. I realized when I looked at all the patients, I realized that the ones that were the most complex and involved the most engagement by me were the ones with cancer, because it was clear I mean, you might not see the psychosocial, psychospiritual aspect of hypertension, but you'll definitely see it with cancer. So what I loved about it is that it truly required everything I've ever known to try and work with these people. So that was it. And so I guess it was around the year 2000 that I started my my work in this area.
So right now, Atkins, I mean, he was mostly meat-based, and I mean that, and here you have the similarities with the ketogenic diet that I know a lot of people are focusing on in regards to cancer. What are your thoughts in regards to diet and cancer? I mean, are you still following those same principles?
No, I was a closet vegetarian at Atkins. I was, because every month, the doctors that worked for him would have to have a solo breakfast with him, right? Across the street, there was a restaurant, a coffee shop, and it had the Atkins menu, and it was, it was like, I think it was a cheese and sausage omelet with a side of bacon. Okay, so anyway, somehow I managed to show up a little bit late saying, you know what, I totally forgot and I ate already. So if you don't mind, I'll just have a cup of coffee. So I got away with it. But he, because he really liked me and all that. So he died soon thereafter. So, but anyway, I absolutely the opposite. And what I teach people is a raw food vegan. I have a chef. As a matter of fact, what I've done now, just so it's clear, is that because the world is so restricted now with travel, I'm finding that even people that would normally come just don't come. Either to Arizona. It's easier in America. I have an Arizona clinic because it's easy to travel around domestically right now. But internationally, for people to come to me, it's just not happening. So, and yet I have a lot of people that know about me and want to come. So I developed this video series of teaching them everything of what is cancer, when to go to sleep, what to eat, how to eat. So I have a chef who teaches, she's got like 12 videos showing how to do certain parts of the food prep. I've got a British psychologist who went and lived with the Dalai Lama for 15 years and became a monk for 35 years. Left the monkhood and now he's married and has children, but he helps people straighten out the madness inside, because if we don't straighten that out, it doesn't go away. And then the third thing we have is a kinesiologist, teaches people how to move all day long. So the idea is that it's completely unnatural to sit for 4 or 5 hours and then to go to a room and go crazy, work out and sweat for 1 hour. I mean, that's as unnatural as the sitting for 4 hours. So what he does rather is he takes a look at your body habitus and all that sort of thing and comes up with these simple movements and exercises that you will do. And so every 90 minutes to 2 hours, you get up from whatever you're doing and you spend 8 to 10 minutes doing these movements, whatever they are. Sometimes he has me crawling on all fours, not my knees, but all fours, counterintuitively. So if you ever want to see how you crawl naturally, imagine doing it the opposite, forward and backward, just things like that, and then squatting and just all different things to keep your body moving, your heart moving, and all that. So it more mimics a natural, the way we would be living before the machine took over the world, right? So so we've got a movement guy, we've got a guy with help with the mind, and then we've got the food prep. Because what I want to be able to do is help people who are stuck at home, and let's say that the only option to them is conventional for some reason. I mean, there may be a town. I mean, there are towns where that's it. Okay, so you got to do that. Your family's pushing you. There's like almost no way out. How do you mitigate the damage, and how do you ensure success? And we've done this with a lot of people who've had to go conventional, and they do. I mean, I had a guy with a head and neck tumor who had to go for radiation, and because his family insisted. But anyway, I gave him a big dose of vitamin C after every treatment, right? And this was way back in Arizona. His radiation oncologist said, I've never seen it respond so well, and you don't have any side effects. He was blown away. So you can augment conventional in many different ways. Yeah, so that's what I'm doing now. Pretty much is I do I do a consult with the person, and then I offer the video series. But I talk about eating the food that we would eat. You know, we have to realize the only reason it's a debate is because we are no longer instinctual creatures. We are enculturated. If I grew up in Germany, I would think that this is food. If I grew up in China, I might think that live monkey brain is food. If I grew up in Tennessee, I might think that bull testicles is food. And so it depends on where I grew up. And so anyway, it's called appetite, where we learn. Because remember, hunger that's a thought, like a craving, I gotta have, is not hunger, it's appetite. So hunger and appetite are not the same. Appetite is a physiological response for an energy or nutrient deficit that needs to be fulfilled. And once it's fulfilled, that physiology goes away, it gets resolved. Appetite, you're never satisfied, right? You just stop eating because it hurts, and then you're going to continue as soon as you relieve a little bit. You know, so there are different things. But anyway, so what happens is by the age of 3, it's done. You're already eating whatever you're eating. That's pretty much the foundation of what you'll eat the rest of your life. And that becomes your comfort food, your emotional food, all that. And it's really, really difficult to change at that point. So the best thing I always tell my patients, the best thing you can do for your children, you give them 2 things. You give them love, number 1. And number 2, you give them health. And what do I mean by that? Don't give them any bad habits to break. Right? You know, I hear kids, my kid only eats chicken nuggets and French fries. Well, where do you get them? Did he go out and...
Yeah, it's not like he's running to the store shopping for the chicken nuggets. Somebody's bringing it to the boy.
Exactly. So it's like, oh, but anyway, so the point is, so since humans don't know because we've been enculturated, we have to look. I always rely on nature to be my ultimate reference. So I ask nature, how do you ask nature a question? Through observation. And through observation, we notice that, humans are classified taxonomically as hominids. Mm-hmm. What are the other hominids? Gorilla, chimp, orangutan. Okay, well, what do they eat? And I mean, it's real simple. So then you do that, and then you look at the anatomy and the physiology, and you realize that if we're going to eat an animal, nature didn't prepare us. I got to get a tool. I got to get a weapon, right? We're not. It's not like a tiger or a rat or a cat. They're all prepared. They don't need any implements, right? They're prepared by nature and instinct. So, you know, we can. I mean, I guess if we were naked in the jungle, we might maybe pick up a frog or grab maybe grab a snake or a squirrel and choke it. I mean, I don't know what we would do because we're not designed for it, right? But you know, people that don't. Yeah, anyway, so that's my perspective. So I look at stuff from a natural perspective, and I put people on a specific diet, and I've seen miracles with it, absolute miracles. When I do ketogenic, when I do put people on ketogenic, and it's not every situation, it's a plant-based ketogenic, and we've been working on it for years. We've got some amazing recipes, but again, one has to realize about cancer. Cancer can use glutamine for fuel too, not just glucose. So even if you've got someone on a perfect ketogenic diet, right, where your ketone to glucose ratio is perfect, you still got a lot of glutamine going around. In fact, there's a lot of cancers that don't show up on PET scan, like certain prostates and some head and neck cancers, because they are pretty much glutamine.
It's especially a lot of, I mean, breast cancer is something that is just exploding. I mean, there's so many cases of it, and that's one of the areas where you really need to be concerned about the glutamates, glutamine then feeding the cancer, but even also some fatty substances, right? I mean, you have like Jane McClelland, coming out in regards to, how to start cancer and what kind of metabolic approach that you're wanting to use. And so in some cases, you also need to shut down the fats as well.
Well, the only 2 fuels that cancer cells can actually use are the sugar, glucose, fructose, glutamine because it fits into the Krebs cycle, so it can ferment them. It can't really. Yeah. There's probably some. Listen. Cancer is the guy that just walked out of Gold's Gym, right? You don't want to. If you're a mugger, you don't want to mug this guy, right? So that's why, the cancer cells. You can give the most powerful, state-of-the-art, new chemotherapy, right? All the cells in the body are going to suffer. You're going to get sick. Cancer after a few doses says, give me more. I like that stuff. So cancer that's what it is. It was born out of being a homeostatic corrective response. It's an adaptive response. So that's what it is, right? So if you're going to mug someone, get the guy that's been sitting at his computer all day, a skinny guy who walks out of his office, not the guy that walked out of Gold's Gym. So anyway, so cancer just walked out of Gold's Gym. So that's why in our approach, you can't beat cancer. You can only overwhelm it because it's smart. You do 1, 2, 3 things, it'll figure a way around it. Just like a river goes around the rocks if you're trying to dam up the river. Okay, that's the nature of nature, because cancer is nature at its strongest, smartest. Okay, it's not an alien that got into you. It's your body adapting in a certain way. So therefore, overwhelm it. So we use all these metabolic therapies. You got to use them all. It's not, I did vitamin C, B17. You do them all at the same time so that you exhaust the cancer cell and you stop feeding it. So on the one side, in our program, we have three aspects. Number one, stop making cancer. If you don't stop making it, doesn't matter how good anyone is at getting rid of it, it'll be back, right? And in fact, what I tell people, you got a little nodule in your breast, it's cancerous. If it didn't grow and it didn't spread, you'd live a normal life. So you're not really saying, how do I get rid of this? You're saying, how do I stop making this stuff? How do I stop doing it? Right? And that's what we need to do. So that's the one biggest aspect, not the biggest, but it's one of the aspects. We have 3. And that involves diet, cleansing, going to sleep right, balancing hormones, prayer, meditation, working on your relationships. If you're lying to a spouse, if you're lying to a colleague or a friend, that's emotional pus. It'll hurt you. So, you got to work on you got to do it all. You got to do it all. Cancer is a tap on the shoulder by God saying, make a right-hand turn. There's a cliff there, right? And so, but if you make the right-hand turn, you're fine. It's not a death sentence. It's just an opportunity to become the person that you would not have become. All right. It's an amazing, and I see that. So anyway, so the first aspect is that, how do you stop making cancer? Secondly, we target the cancer with metabolic therapies, vitamin C, all these things, because what they're doing is they're challenging the cancer based on the cancer's lack of certain enzymes, because it's a different type of cell now. It doesn't have a lot of catalase. It doesn't have a lot of superoxidase. So it can't really defend itself in that situation. Okay, so put it in that situation. And in that situation, the other cells actually flourish. They do well. So that's a metabolic as opposed to a cytotoxic therapy. So, we have a number of those, from intravenous curcumin, intravenous quercetin, B17, what's the other one?
Artesunate, boswellia.
Artesunate, all of them, and vitamin C. And then how do you do vitamin C? And in what sequence do you do these things? People think, well, it blows my mind. I hear people giving vitamin C and glutathione in the same bag.
In the same bag?
In the same bag. They just neutralize each other, right? There's nothing, so people don't realize that if you're going to give therapies, you need to understand the science so you know what sequence, maybe not even on the same day and stuff like that. So anyway, and then the third part of the program, which is the part that is the home run that takes you all the way, is waking up the immune system. Because cancer, being as clever as it is, actually could have worked for the CIA and been a good. It takes our macrophages, as you probably know, and turns them. They become tumor-associated macrophages. So it takes our team that's out to protect us against the cancer, and it turns it to support the cancer. So it does that. It also disguises itself very effectively, and then it also just turns down the strength of the immune system. So the immune system's weakened. It's kind of blinded. Some of them have turned. And that's the real reason why when we see somebody who's been treated getting all sorts of treatments, and nothing is working anymore. It's because the immune system is gone, right? And you've got to wake it up. And so I've got a certain group, we've got a certain system of waking it up, including peptides and interleukin-2, you know, everything is all science-based, but you know, TA1, thymosin alpha-1, IL-2, some really good data on that combination in particular. We use systemic hyperthermia. There's a lot of different ways of waking up the immune system, and you can measure. You can look in the blood, look at the lymphocyte subsets. You can see who's waking up, who's not waking up. You can look at gamma interferon, because that'll tell you if you're recruiting. I mean, there's all kinds of ways of assessing whether or not you have awakened the immune system. And so that's the third part. Okay, so stop making cancer, target and eliminate without harm, and wake up the immune system. And if you do all of that, you've got a really good chance of doing well.
So this is one of the reasons why, like things like chemo, radiation, surgery, why it keeps on failing. Because they don't waken up the immune system. They don't put your body in a place where you stop making cancer. I mean, in essence, those type of therapies, they actually promote cancer. So you completely fail the first step, and you completely kill the last step. So yeah.
Right. It's like if you want to not succeed, do it that way, right?
Yeah.
Right, exactly. In fact, on the True Second Opinion, we devoted several episodes to chemotherapy, and we go through the details of exactly what you're talking about. How specifically does chemo, and can you ever use chemo? Sure. Turns out you can. Turns out metronomic low-dose chemo actually stimulates certain parts of the immune system. So it turns out, so that's why we really need to come to an understanding. That's why it's called integrative oncology, right? No one discipline has all the answers.
No.
You need to bring them all together. Yeah.
Well, and that's so you're talking about the second opinion. I mean, what is that? I mean, we know about the first opinion. So what is the second opinion?
Well, what I have found over the years is that people come to me and they say that they went to this large cancer center and this large famous cancer center and another one. They went to 3 different large cancer centers and they all said the same thing. Well, I understand that they didn't get a first, second, and third opinion. They got 3 first opinions. And the reason I'm saying that is because I know the training. I went through the training.
Yeah.
And the training is the same. It's the same algorithms. It's the same basis. For example, they all subscribe to the somatic mutation theory of cancer, right? So therefore, they're going to work from that. That's their foundation. And then they've got algorithms. So the reason that medical doctors love, and the reason why, what is illegal? When they say you're practicing medicine without a license, what are they talking about? That means talking about you do 2 things. Number 1, you diagnosed. And number 2, you made a treatment based on that diagnosis.
Yeah.
What is a diagnosis? A diagnosis is just a name. You give it a name. And the name means nothing. So for example, if a diagnosis was so powerful, it should tell us 2 very important things.
Yeah.
How did I get this? And how do I get rid of it?
Yeah.
But it doesn't. In fact, a diagnosis is just a descriptive word or set of words, right? Intraductal carcinoma. Oh, that sounds like you're smart, my God. What does it mean? It means, it started in the duct. What is it? Well, it's cancer. Oh, is that all it means? Yeah, all it means. So in other words, so a diagnosis is a name, but they want the name so that they can stick it into their algorithm.
Yeah.
And they don't no longer have to think.
No.
Well, we learn in medical school, I learned early on in rounds, don't have an idea.
No.
If you're going to say something, say, well, the New England Journal in 1998, in the July 3rd issue said, blah, 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 blah. And then we found it, if you can repeat and regurgitate that sort of thing, in other words, what they call the standard of care. If
Yeah.
you can repeat and regurgitate the standard of care, in other words, the party line, right, then you're a good, smart doctor. So in other words, they teach you how not to think, how just follow the algorithm. So you go to this big center in New York and you go to another big center in Texas, and they give you the same opinion, except they told you to do this first and this guy told you to do that first. It's like going to 3 different Toyota dealers. One might sell you a Corolla and one might sell you a Lexus, but you're going to get a Toyota. You're going to get a Toyota.
No matter what. Yeah, because it's the same standard of care that they operate out of. You know, so it's the same box, same frame that they kind of give the diagnosis from, and the treatment protocol. It's not going to deviate. They're not going to talk about drink, carrot juice. They're not going to talk about, well, you should go down to the clinic down here, get some vitamin C right after your radiation. That way your immune system is protected. Or while you're doing surgery, when you become immunosuppressed because you're doing surgery, and that's when we have a chance to spread this cancer because we're messing with it and we're suppressing the immune system. You should do vitamin C then. They're not going to say that.
They won't. And the reason that is so egregious is that they haven't studied. They don't even know whether or not vitamin C would be good, and yet they feel that they have the authority to give an opinion on it. Right? It'd be like me walking into an IT meeting and giving an opinion on. They don't know anything about vitamin C. They don't know that it actually makes the chemo work better.
No. Yeah.
I mean, it actually, because the doses are pro-oxidant, not antioxidant, and their whole argument is, well, you're suppressed. No, you're not. You're not. You give that vitamin C before, it's going to be the cancer, and then you give the chemo. The cancer is you're going to wipe it out. Yeah. Right. So anyway, or even after, in that case, you can do either. But anyway, the point is, no one should ever give an opinion about something about which they haven't studied, they haven't learned all that, especially when other people, the people listening, life depends on it. Right? It's not like Botox or buying a pair of shoes. This is a big deal. So you better know, if you're going to talk to a person and they came to you and they put their life in your hands, you better really be speaking from the heart and the brain. You know what you're saying. And if you don't, say, I'm sorry, I don't know that. And that's what they should say. I don't know. I've heard that it works, but in my position, I'm working at this big clinic and I can't recommend it. That would be a great thing to say,
Or they throw this thing out that, well, there's been no studies on that. You pull up curcumin in cancer, for instance, on PubMed. How many studies do you find? I mean, it's thousands upon thousands, so to come out with that there are no studies on this, I mean, that's ludicrous.
Well, it just means that they're not studying anymore.
No.
They're going home and watching TV and playing golf. They stopped studying.
Yeah.
But no, really, and we also know that and this is another one of the topics we discussed, is that what is published. Who are the ones that select the studies for publication that then the doctors in each specialty read, right? Okay, we find out that a lot of these people have to resign because they've been taking money and all that, even though they declared at the bottom of the study that they had no financial ties, but it turns out that they did. And we're talking about I don't know, you remember a few years ago, the head of Sloan Kettering in New York had to resign because of that sort of thing. So when the doctors, what they read, it's very selective part of that which is published. Like you said, thousands of curcumin in cancer and vitamin C in cancer. I mean, vitamin C, there's been clinical trials at the University of Kansas. It's just NIH. It's no longer really alternative. I think it's come out of the closet. Yeah.
So I'm curious, going back a little bit to the diet, because we had the foundation, you were talking about the diet, and obviously your mental well-being and then movement. Those are like the 3 pillars that you got to stand on, and then the rest is gravy, everything else. You add on to it. So why is, I mean, you mentioned that, we obviously, we don't have any ways to kill an animal other than strangling a squirrel or a rabbit if we can catch them. But what does plants do to us, that is so important while we're dealing with cancer?
Okay, good. Well, let's think about what are nutrients. There's three what we call macronutrients, right? Carbohydrates, proteins, fats. Okay, where are these produced? Where do we get those? Well, it turns out that all three of them are produced fundamentally in plants. In fact, it's only the plants and their microorganisms that can take nitrogen from the air and put it onto a carboxylic acid group and turn it into an amino acid. So de novo means out of nothing, they can produce amino acids. Animals cannot. Animals have to have what are called essential amino acids. Once we've had our essential, like with humans, it's 9. It's about 9, 10. 10 when you're a child. But anyway, 9. That we need to have. And from those, we can make all the other 20. So plants can make all 20. Animals can make about 10. So, but the nitrogen fixation is not an animal doing. They can't do it. All right. So that's that. So amino acids are produced there. And amino acids, for those who aren't familiar with the chemistry there, are the building blocks of what make up peptides and then proteins. Right? That's what amino acids are. Now, fats, where do fats come from? All oils originate in seeds and nuts. That's it. That's where they come from. And then and all that. And of course, animals make their own fat and things like that. So when people talk about high-fat diets, low-fat diets, if you're talking about that unhealthy fats, I would say 0%, right? But I'll talk to you in a moment about high, because I think we really all need to be on a high-fat diet. I'll tell you exactly why. But so that's the fats. Fats originate there, and the fats that are produced that our cells actually need come only from plants. Well, no, they come from fish. No, they don't come from fish. Well, what about DHA and EPA? What about DHA and EPA? These are very long, unsaturated fatty acids that are easily oxidized. And once they become oxidized, it's called rancidity. And where do we find high levels of EPA and DHA? In cold water fish, not warm water fish, cold water fish. Why? So that they can keep the fluidity of their blood and their membranes in the cold when they're swimming around icebergs and stuff like that. It's a whole different thing. That we're not cold water fish. Now, what we have to understand about fatty acids, for example, sorry to digress, but there are what we call the parent oils, right? Which are the omega-3s and the omega-6s. Then they have derivatives, which are the EPA and DHA. Those are derivatives. Okay, so our body needs the essential parents, and then we'll make the derivative that we need. We don't need a ton of EPA. We don't need a ton of DHA. In fact, when we look at longevity, and this is a very, very relevant understanding. When we look at longevity, and they do this when they look at animals, longevous animals, for example, rabbits versus an elephant, right? I mean, similar, they're both vegetarian. How come one lives very short and one lives a long time? It turns out to be the longevity is inversely, that means oppositely related to the peroxidizability index of the mitochondrial membrane. In other words, the mitochondria, which are the little organelles in the cell that make energy efficiently, that allow us to live, the membrane, which is made of fatty acids, the strength of those determines how long you'll live. Nothing else matters. Nothing else trumps that. We can use that word now again, but nothing else trumps that. And look it up. Look it up. Nothing else trumps that. And the one specific, really important fatty acid that's made only in mitochondria is called cardiolipin. And cardiolipin happens to have 4 fatty acids that are all omega-6s. Yeah, so we need, anyway, so we need omega-6. Those come from plants. We don't need the derivatives. We need the parents. The parents come from plants. So that's fats. And then carbohydrates I mean, glucose is the fundamental carbohydrate, and it's the end product of photosynthesis. Plants make it. So all the macronutrients are there. Then let's talk about the micronutrients, the minerals and the vitamins. Well, the vitamins are plant. You don't get you get a vitamin from eating an animal. You'll get a vitamin that it ate, not that it produced. Okay, and then and minerals. We're not really good at minerals. We can't just walk along. I can't like go outside, grab a handful of dirt, and just eat it. I mean, I could, but I'm probably not going to assimilate that much. So what I need is I need the plant to pick it up and to make it bioavailable. And that's where I get my magnesium and my manganese and my selenium, and I get my molybdenum and my boron and all these things that I need. I can't eat them. I got to let the plant do it. So the plant does it. So why do you need plants when you have cancer? Because this is the time in your life that you've got to be absolutely 100% spot on with your nutrition, satisfying your nutritional requirements. And if I may, for a moment, just mention that cancer and all other conditions that we call diseases, you know, the disease model implies that there's something external to the body that gets into you. Oh, I got it, diabetes. I'm not sure where it is, but I know I got it here somewhere. So I don't go to the doctor to find out where. Anyway, so there's no thing that got into it, called hypertension, called diabetes, called stroke. Where is the stroke? So I mean, but that's how we think. So we think, then we go to the doctor, they give us the magic potion to get rid of it. This is very primitive jungle medicine. Okay, it's a very poor understanding of the way the body works. So what happens? I'm eating too much pasta, bread, potato, cake, rice. So I got a lot of glucose in the fluid around my cell. So my cell has the wisdom of God. My cell has the wisdom of nature. And my cell says, it's going to kill us. We need to keep that glucose out. It becomes insulin resistant. So insulin resistance is not a disease. It's an adaptive response. So what do? Take a drug? Stop eating the pasta, bread, potato. Huh? Anyway, so
I thought the solution was to get more insulin. I mean, to shoot yourself up, and then yeah.
Right. And then you've got high insulin levels and high glucose. But here's the problem with that. We know that cancer cells have more insulin receptors because they need more glucose. So if the higher your fasting insulin is, the more you're preferentially feeding cancer cells. So that's why when I put people on a diet, we've cleansed them first. We've done all that, colon hydrotherapy, lymphatic therapy, juice therapy, or fasting on water, whatever. Then we ease them into a good, healthy diet. There's got to be at least 18 hours between your last and your first meal. And the reason is because you need to bring down that fasting insulin. You need to, because it's the dynamic between insulin and glucose that underlies most pathology. I mean, syndrome X, hypertension, all of it. You bring it down, and so that's how you do it. That's the main way you do it. I like 20 hours even, and it's easy. You just got to do it like a week, and you'll get a habit, because you're going to sleep 8 of those hours. The other thing is you got to stop eating 3 to 5 hours, depending on your age, 3 to 5 hours before you go to sleep, right? And if you do that, you stay in that window, and you do that. And then the other thing I didn't mention that's very, very important, and that is sleep. I'm right now in the middle of at the end of a book called Why It Has to Taste Good. Okay, and in that book, one of the things I discuss is something called willpower. Now, it turns out
I don't think Americans know that word quite yet.
No.
Yeah.
No, it's part of that new educational system, right? Right. But it turns out that when you go to sleep according to your biological sleep time, and your body is allowed to go through all the physiological repair, then you wake up feeling fantastic and ready to do what you already know, because everybody knows, is there a cigarette smoker alive that doesn't know they shouldn't smoke? Is there an alcoholic that doesn't know and is there an obese person that doesn't know they shouldn't? No, we know. Why don't we do it? because I really think, and if you look at our relationship to the earth, the circadian rhythm, there are 3 hours, 56 minutes and 4 seconds in one revolution, one day. And our biological new day begins somewhere around midnight to 2 a.m. And that's our whole new day. We start to make new hormones and stuff. Well, if we haven't had enough restorative sleep before that biological reset point, we're not going to have a beautiful symphony of hormones, or we will not have restored our physiology, our mitochondria. Autophagy will not have been given a chance. So if you ate before you went to bed and stuff. So anyway, sleep. So what I talk about with sleep is, I think the most important thing, because if you go to sleep early and sleep long, you'll have the willpower to do everything else. If you don't go to sleep early, you won't have the willpower.
So
right?
You're actually saying that just a simple measure of going to bed on time and allowing yourself to have appropriate amount of time of restful sleep can break all these negative addictive patterns.
Absolutely. Absolutely.
That's a powerful statement.
It is. It's about, what I say is that today began last night.
Oh.
Tomorrow begins tonight. So if I get on the A train, I'm going to wind up in Harlem.
Mm-hmm.
So that's it. So if I keep getting on the A train and I don't want to go to Harlem, let's say I want to go to somewhere else, I'm in trouble. I'm going to wind up in Harlem. That's it. So you have to understand. So you go to bed at this time, that's the train you got on for tomorrow. Mm-hmm. You're going to wake up, you're going to be on your third cup of coffee, and you're driving to work, and you're going to see that Winchell's donut, or you'll see the McDonald's, and you'll say, what the hell? What the hell? Humans love that. And we also love to start tomorrow, right? I'll start tomorrow.
Yeah.
So, anyway, but you went to bed early, and then I have some other things you do. When you wake up, you do some meditation, prayer, then you do some reading, because that's the time that you'll actually remember what you read, and then you do your exercise, your movement. So you take care of your mind, body, and spirit before you leave the house. Mm-hmm. You've done all that, and you're going to walk by all the temptations. You don't do that, and you won't walk by them. It's just, I've been doing this for a long time, 35 years, I got to tell you. And that's just the medicine, the psychology part before that. But I'm just saying, yeah, you got to do that. Sleep is the number one. And then if you do that, you'll be able to be the person that you can be, right? And the thing with cancer is that it's showtime. There's no more rehearsals. This is it. It's do or die, and you got to do it. And if you do it, it will turn out to have been the best thing that ever happened, because you became, and I can't tell you how many people have told me that, that, well, this changed my life. Now my kids changed their lives. I became something that I wasn't, and my kids are emulating me. I had a woman who was a professor, SUNY, when I was in New York, and she changed her life, and she quit being a professor and went back to naturopathic school. Changed her life, and she wanted to, yeah. So it's amazing, but that's what cancer can do. It can be. And so I tell people, if you have cancer, you're anointed. Not everybody gets it. You've been anointed. Just go through the what you need to now, and you will be amazing. Yeah.
So and I hear that again and again, exactly like you. That this was like the greatest blessing in my life, that I developed cancers, because finally I couldn't couldn't excuse, there were no excuses anymore. Like you're saying, it's go time. I better do it, or otherwise I have no other chance. And after them doing it, their life just opens up to them. But exactly. So tell me some cool. Do you have a couple of cool stories, that came into your clinic, and what you did, and what happened?
Yeah, I've got one very. This one it's very poignant. This was in 2001. Yeah, June of 2001. I was in New York. I was in Glen Cove, I think, Glen Cove, New York, in Long Island. The woman came in, and she had breast cancer that was everywhere. But the thing that was bothering her, she already knew she was going to die, because the doctors told her that, which should be illegal because they don't know when they're going to die. And if they're so good at this, tell me what the lottery is, because I'd like to win that, right? They don't know when they're going to die. They don't know. How many times have I had two husband and wife, one of them has cancer, and the spouse that doesn't have cancer dies first, has an automobile accident or whatever, a heart attack. No one knows, so don't tell someone they're going to die. It's not, you don't know, number one, so it's called a lie. And number two, because of your authority, it has power. And it's so I call that sorcery. It's just nothing less. Is there another word for it? It's sorcery. Right. But anyway, this woman came in, she knew she was going to die, but she had these lymph nodes here. And she said, can you just help me? Because I can't lift my arm and all. So I talked to her. I gave her this talk that I used to give to all the patients about stop making cancer. And not only when you stop making it actually goes away too. But, and then I told her our treatment. She goes, I don't want to do any of the treatments. I just don't want to. I just want to do what you said. So she changed her life completely. Fasting, cleansing, colonics, yoga, had some special counseling with her husband, all this. And so I said, well, you come in every month. Let me just see how you're doing. Because she didn't want treatments, right? So she came in every month, and every month she could move more and more and more. Now this was, I met her in June of 2001. And then the last time I saw her, I think was December, and she was fully feeling great and all that stuff. We didn't do any blood tests. She didn't want to do. But in January, 6 months after I had met her, she had a fatal automobile accident. And when they did an autopsy, there was no cancer.
Oh, really?
Yeah.
But so it's almost like she programmed herself she was going to die. So she was dying,
right,
even though there was no cancer. I mean, there was not
exactly.
cancer. Yeah.
Right.
Like you're saying, sorcery. Yeah, you're going to die. And she programmed herself. Yeah.
Right. Exactly. And then, but the point is there was no cancer. And there's no way you could have really known that other than an autopsy.
Yeah.
And you don't do autopsies on live people. So this was a ridiculously amazing situation. Her husband and I got kind of close, and we realized there was two really important things we learned.
Mm-hmm.
Number one, well, that exactly that he said he was happy about it. He said, we're broken that she died, but these last 6 months she was living, not dying.
Mm-hmm.
Yeah. And he goes, number two, we've learned that the number of days is not up to us. Mm-hmm. It's our quality of days, right? Because they were very Christian, very religious. And so they said God wanted her one way or the other, but she went out living and happy. Our relationship improved. It was a really beautiful, beautiful story. There's another one. And the reason I want you to understand that what I think is necessary is here. I see cancer now, the tumors as the fruit on the tree, and the roots are psychospiritual, psychological, sociological, spiritual. I had another woman, again, breast cancer, but everywhere. This was Arizona, and it had filled her lungs. So she was on oxygen. She was brought into my clinic on a gurney, right? And she was, and so in the middle of the front of our waiting room, not waiting, people don't wait. We just come in and go to work. But in the middle of the room where people are reading and stuff, there she was in this gurney. She had oxygen. When I walked up to her, she smiled. She grabbed my arm because she knew, she had seen a lot of my videos. She grabbed my arm and she said, thank God, now I know I'm going to make it. Now, she had just come from her doctor who told her she had 3 weeks to live. 8 weeks later, she was jogging to our clinic and her husband would drive behind her to make sure she was okay. 8 years later, I get a postcard from Paris. She was on vacation. So what was the difference between her and the other person next to her didn't have that outcome? She knew it. She didn't believe it. She knew it. And that's when I talk about non-religious faith. What I mean is, faith is when you know what's going to happen before it happens. You don't believe it, because I think that when you say you believe something, that means there's doubt. I believe you. Okay, so I think you can only believe in things that are not true, like Santa Claus and Easter bunnies and tooth fairies. But you don't believe in mountains. You don't believe in trees. You don't believe in oceans. You either know about them or you don't. You grew up in the desert. You never saw an ocean or a mountain. Your friend's not going to say, do you believe in oceans? They're going to say, do you know about oceans? So that which is true is either known or not known. That which is not true is believed or not believed. Okay, according to my Lodi logic. So, so anyway, you cut your finger. You're peeling an apple. You cut your finger. Do you believe it's going to heal? Or you know? You know it. You rinse it off. Put a Band-Aid on. Done. And so when you know this is gone, that's it. It's gone. And that's what I saw. That's what the first woman did, and that's what this woman did. They knew it. The other people that are always afraid, well, what about this? What about that? That's what I've got to work on more than, the protocols and all that stuff is just, what was it? Voltaire. Voltaire said the role of the physician is to entertain the patient while nature cures them. So I consider myself a medical entertainer, but anyway, it's working with their psyche, right? And part of, like in Alcoholics Anonymous, and Narcotics Anonymous, Overeaters Anonymous, the first step is to accept where you are, right? Surrender to the reality. Now, surrender doesn't mean giving up. Surrender means you're going to now begin the real battle, the real challenge. That's what true surrender means.
Well, seeing things as they are instead of, lying to yourself, living in an illusion, that I'm fine, even though we're dealing with this trauma that we haven't dealt with, or I'm okay,
Exactly.
even though I'm eating these Dunkin' Donuts. It is recognizing where you're at and then doing a proper inventory of the garbage you got to deal with and move through it.
Exactly. I think the 12-step program would be perfect, because we're all really addicted to Maillard chemicals. Maillard chemicals are when a sugar and an amino acid come together through heat. It's called cooking. Mm-hmm. And it's these Maillard chemicals that impart the specific odors and tastes of cooked food. And we're all addicted to it. We walk into a restaurant or you walk home and, right, you start salivating at this Pavlovian moment. It's Maillard. We're addicted to Maillard chemicals. No animal, no creature on the planet cooks, mm-hmm. Right? And when you look at, if you did a chemical analysis of a tomato versus tomato sauce, they're different. It's not the same at all. So you've altered it. It's no longer what nature designed for your nourishment, right? And we know the wild animals 200 years ago. No, the last 200 years we've poisoned the earth so much that even the polar bears are poisoned. But wild animals die from three things: trauma, starvation, old age. They don't get diabetes. They don't get insomnia. They don't get heart attacks.
And like you're saying, these diseases are so-called diseases. Again, it's not something that's attacking us from the outside, and all of a sudden we have to defend ourselves against it. Or like you're saying, the germ theory. I mean, we live with germs, all since the beginning of time. So it's not like all of a sudden now they're starting to attack us. It's right. The pool that we live in. So these so-called diseases like cancer is more than an adaptive response. It's a body trying to correct itself when it lives in an unnatural situation.
Exactly. That's it.
So if we then just bring the body back to the environment that it was supposed to be in to start with, then, like you said, we're not feeding cancer. We're not feeding diabetes. We're not feeding...
And there's no need to adapt now.
Yeah.
Right. So that adaptive physiology that they call pathology, it's not pathology. There's nothing pathological. It's adaptive physiology. It's high-powered physiology. I'm going to fix this problem kind of thing. They call it pathology because pathology is the road to disease. That's their whole model. and it's based on the germ theory. The germ theory is absurd because there's 100 trillion microorganisms inside and then on our bodies. They're all over. There's 44 species on our forearms that if they weren't there, we would have pathological bacteria cause rashes and all sorts of problems. We'd have problems. Everything is in perfect harmony. In fact, there's a new term that's come out. They used to call symbiosis, right? Where let's say a parasite or a microorganism is living off another organism, the host organism. So it's a symbiont, right? So what they're calling it now is that we are holobionts. A holobiont and holobiosis is that I don't have just 20,000 genes in my genome. This part has that, but I've got 20 million genes in my entire genome because I could no longer live without these bacteria and microorganisms that I could live without a heart. Just wouldn't live. Mm-hmm. They are absolutely essential. Do you know 90% of our serotonin is made in the gut? And most of it is made by bacteria? I mean, and it goes on and on and on. So they are they them or are they us? We have to redefine us. And they're really us, and we live with them. If I went around and did a throat swab on everybody, a lot of people would have strep, staph. They're not sick, so you can't really say we have a case of strep. Yeah. You have to say, like that's a very popular term nowadays.
Yeah. A case of, yeah.
Right. But anyway, that's just not a case. If I have 10 cases of cancer, they all have cancer. They don't just have positive tests. Yeah. So anyway.
Yeah.
But the point is we're swimming in more, and we need them for everything, including our moods, our appetite, or our ability to digest, our immunity. So anyway, so we are a holobiont, and we have many organisms and all that. And so it's very interesting. There's some studies where they look at kids that grow up in middle class and upper class homes versus kids that grow up in the inner city. Mm-hmm. They don't see in the inner city, they rarely see atopy, rashes, autoimmune diseases. Mm-hmm. Why? Because the studies are pretty detailed because they've been exposed to mouse, cockroach, and all kinds of antigens. So what's happened is if people that understand immunology, it requires your Th1 aspect of your immunity. So not your Th2. So you're strong. So that means now see what happens with the guy in the middle class and the upper class is that they got everything's cleaned and washed and there's baths and all that. And there's nothing in the house and they get vaccinated and all this stuff that prevents them from developing muscles on their immune system. Their immune system has no muscles. And so the Th2 side of immunity goes up, and that's the one that's responsible for autoimmune conditions, right? So they're Th2 dominant, whereas the guys coming out of the inner city, they're powerful, and you also don't want to fight them. But you don't mind fighting the guy from Beverly Hills because he's so that, it's the difference. So in other words, you want to have a strong muscles, you work out, you have resistance training, right? You want to have a strong mind, read and debate, right? You want to have strong immune system, challenge it. And that's how the immune system becomes what it is through challenge, right? So anyway, I think we do everything backwards.
Yeah, and that's the thing. We try, as we try to separate ourselves from the environment that we live in, we develop in a natural situation. So now in order to be able to protect ourselves from these so-called pathogens or germs, we try to live in a sterile environment, but because of that, our immune system is then not exposed to and not able to deal with that if and when, because it is going to be a when. I mean, it's not possible to isolate yourself forever. Right. There is going to be a moment when we are exposed. So when we're exposed, are we going to be then in a place where we've already trained, we're ready to fight? We've dealt with this before and it's a piece of cake, or is this going to be the first time ever we deal with it?
Exactly. Which is kind of what we saw with the Hawaiians. when Captain Cook went over to the islands back in the 1700s and brought measles and syphilis.
Yeah.
And wiped out almost half the race, if not more, because they had never seen those sorts of things. So it's the same sort of thing. We need to, a lot of what's that colostrum? Colostrum is sold in a lot of health food stores. Colostrum from what? From cows that lived in isolated environments? No, cows that had their face in the dirt all day long, eating and all that. The dirty, dirty cows. Their colostrum was powerful. We want that's the colostrum. You want a good, right? So you've got to have. I mean, it only makes sense. And we're if you're eating organic food, pull it out of the ground. Yeah, wash the dirt off, of course. But don't scrub it.
Yeah.
Don't scrub it. B12. It's interesting about vegans and B12, right? Oh, if veganism was natural, first of all, I don't think you need to be a vegan. I think being a vegetarian is enough, because I think that's what we are. But anatomically, physiologically, but being a vegan, it turns out that there are generational vegans in India. Never heard of B12. They don't suffer from it. Why? Well, it turns out that B12 is a molecule that's produced by microorganisms. In fact, some of the oldest microorganisms in existence called cyanobacteria, and they produce B12. So the animal, when you eat the animal, it's because the animal had the bacteria, and he or she got the bacteria from having their face in the dirt and eating. They didn't clean everything, so that's how they got it. So those microorganisms. So it turns out it's very interesting. Some of the bacteria in our colon produce B12, but the only place that we can absorb and assimilate B12 is in our ileum, which is our small intestine. So we were designed that way. So if we're making B12 in the bacteria in our colon, it's south of the border and it's not going to work. So it turns out that people that eat this way for a long enough time, those bacteria can now, because of the food they're eating, can migrate north of the ileocecal valve. And now we can produce, and it doesn't become an issue. So B12, and plus if you're not so clean, get dirty. It's okay. And don't use the word dirt. Dirt is a pejorative term. Let's use the word earth. Get earthy. Get some earth on your body.
Yeah. Enrich yourself. Yeah. With
exactly.
Complexity. Yeah.
Exactly. Beautifully said. Yes.
Yeah. Well, Dr. Lodi, it's been such a pleasure to have you on the show. I mean, is there any other kind of point or final words that you feel is very important for somebody who's just been diagnosed with cancer, that this is like a key aspect that they should know, before they start their journey?
Sure, that's a very important question. If you've just been diagnosed, the first thing you need to know, unless you're in severe pain or a vital function is being blocked, which normally that doesn't just come to your attention. But let's say you just found out and you're not in that condition. First thing you need to know is that there's no hurry. There's no rush. Now is the time to do good due diligence and find out what really fits with you, your family, and everything. And remember, just like pregnancy, it may be the mother that's pregnant, but the husband and wife are going to have a baby, right? So it's a family affair, and it's the same thing with cancer. As you know, your husband, your children, your parents, everybody is affected. Even the dog is affected. So it's a family affair. So you want to get together with your family. You want to try to come together if you can and this is very difficult, on the right approach. But do your due diligence. If you were going to buy a new house or a new car, you would look at consumer reports, you would do all the stuff. We don't do that. With the medical, unfortunately with cancer, we're sort of hypnotized, right? We go in there, okay, whatever they say, right? And then I've had so many people come to me and they look around, they see people with the same same cancer that diagnosed, and they didn't have the surgery and they're fine. And they see that and they go, I wish I had known before I blah, 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 blah. So anyway, so my point is this: if you have even a small lump, it's been growing at least 8 years. So don't worry, just take your time, get yourself together, get your loved ones and your family together, start collectively doing your homework discuss it as much as possible. And then the problem is what I have found is that if you're not really adept or knowledgeable about all this, you become overwhelmed because the internet's and for every opinion, there'll be two opinions opposite it. And that's kind of why I did that video series I did, because I kind of say, okay, well, look, I've been doing this for a long time. This is what's real. And by the way, when you're hearing the truth, this is the beautiful thing about the truth. It needs no references. It feels good.
Yeah, it just
when you learn to count, exactly, it resonates. When you learn to count to 10, and then someone said, look, by the way, look, 1 and 1 is 2. Yeah. Oh, it feels good, you know? So anyway, so that's the thing about the truth. If someone's got a lot of words and they're scratching, and you're scratching your head, it's probably not true, right? So the truth is usually simple. It's simple. That's why dogs, cats, elephants don't have to go to seminars to learn what to eat.
They do it intuitively.
They do it intuitively. They know to move around. They know unless we domesticate them, then we destroy them. And if we look at our domesticated pets, they have the same diseases that we do. But their wild counterparts don't. So anyway, the point is this: don't worry, do your homework, come together, find out who's on your team, and then also another very important thing is you're going to have to realize is that if you're in a relationship with somebody who has the opposite opinion that you do about what you should do, that is a very difficult situation. And you gotta listen to your gut. You gotta listen to, because you're there. It's your body. You're the one that knows. And I had a husband and wife who said we're not going to see each other this year because the wife was sick. She said, "I'm sorry, I love you, but I gotta take care of myself."
Yeah.
And they got together actually 2 years later, and it was good. It was great. But even if they hadn't, and she was still alive, they both would have been happier for her. Right. So what we have to realize, and that's not, I know that sounds harsh to some people, but dying young is harsh too.
Yeah.
Right. So anyway, that's what I'm saying. Try it. Those are all the things you need to get together, find out which path is best. And really, if you believe in your heart that going to the hospital and getting the surgery, then do it. They do it. But at least take care of yourself, change your diet, go to sleep early, do all these things so that you can not get the side effects, because most people die from the side effects. I don't think they're on the side. I think they're right in front of you, but they call them side effects. But
they're just
most
effects.
people,
yeah,
just effects, another effect. Yeah. So, but that's the thing. So if you're taking care of yourself and you're healthy and all that sort of thing, and you go the conventional way, because if you want to do that, that's what you should do. You won't get so sick. You won't have all the problems. You will probably have a good outcome. So that's my advice to people who just got diagnosed.
Yeah, and this point, like you're talking about, if it feels good, like the one and then comes two, if it feels good and two feels right, then that's a good place to go. Versus having to do therapies that are promoted and that you're choosing just based upon fear.
Exactly.
If you have to drive a therapy using fear, then I mean that's not the right way to go about it.
No. And we know that we can measure fear decreases gamma interferon production. It decreases natural killer cell function. It inactivates T cells. Whereas joy, hugging, love do the opposite. So that's why it's so important. And then really one other thing is go get a bunch of DVDs, they still have those, of a comedian that makes you belly laugh. And laugh every day, belly laugh. If we measure your natural killer cells after a hearty laugh, they're way up there. So really, we have to understand that the immune system is a slave to the mind, and respect that. So,
yeah, like Norman Cousin, the psychoneuroimmunology, where
exactly.
You have the immune cells. They have all these receptor sites for these hormones and neurotransmitters. So
that's the field.
Yeah, it's fast. Well, Dr. Lodi, it's tremendously an honor, and thank you so much for everything that you're doing for all the patients in this field. And this is it's such a scary time in people's lives. And then to have somebody that have a direct course and direct path that they can step into is so important. So thank you so much for being there for these people.
No, you're very well, and I appreciate you having me on so much. I really appreciate it. If someone is interested in reaching me at all, just, I have a website, drthomaslodi.com, or just drlodi.com. And I discuss all of these things, and I do Instagram TV shows twice a week, on small topics like this, because it's just good when you have cancer and there's all this information and you've got your well-meaning friends telling you stuff. It's just good to hear the other side of the story, and to hear that. So anyway, thank you so much.
Thank you so much.